Does this scenario sound familiar? A patient sits down in your chair, they're a contact lens wearing patient, and they say, Doc, I've been wearing contact lenses for years. Why do I have to pay for a contact lens fit every single visit? Full transparency, this is one of the most common and misunderstood questions optometrists face from their contact lens wearing patients. So, by the end of today's episode, you're going to know why contact lenses, while they're still worth offering to your patients and prescribing every single year. You're also going to learn how to confidently get ahead of and answer this question without losing patients' trust. Welcome to the Ryan Reflects podcast. I'm Dr. Ryan Corte. Wherever you're listening, make sure to hit that subscribe, follow, or like button. That small click tells your platform this is content worth sharing. And my promise to you is to keep delivering value that helps you grow as an optometrist. Thanks again and enjoy today's episode. So I was recently on Facebook, one of the Facebook optometry forums, and the question was presented about contact lens evaluation fees and patient pushback around them. And to me, it's something that I think we need to be intentional about how this message is delivered to patients because it is a valuable service that we provide as optometric professionals. And so we're going to dive into that today. But before we do, I just want to revisit the reality, which is we need to be offering contact lenses to every patient who's a viable candidate, right? So there are a number of reasons that you would want to be prescribing contact lenses to patients who are candidates. There's the clear and obvious vision benefit. Some patients just see better in contact lenses. There's no fogging to their glasses. They have the ability to play sports, to go and live and have the freedom and flexibility to see how they want to see without having glasses on their face at all times. Of course, there's that lifestyle flexibility. We have patients who come in and they want to have maybe that part-time wear. They're going on a beach vacation. They have a prescription pair of glasses that they wear maybe around town, but they have a really cool pair of Plano sunglasses that they bought and they want to be able to throw them out at the beach. Maybe they're going to travel and it's a special event or occasion and they just want part-time wear. So it's that flexibility that maybe they're 80%, 90% glasses wear, but they want that 10, 20, 30% flexibility to see well without having glasses on their face. Oh, and by the way, there's the technological advancements that have taken place over the last 5 to 10 years, new materials, designs, coatings, you name it. Contact lenses continue to improve on an annual basis, and the big four manufacturers out there are continuing to push the envelope year after year. And oh, by the way, let's not forget that myopia management and specialty services are continuing to open up, and contact lenses are a huge part of that equation. And if all of those factors haven't already convinced you why you should be offering contact lenses in your clinic to every viable patient, don't forget about the practice growth component. When you fit and prescribe contact lenses to a patient, you're opening up the opportunity for them, especially if they came in and they didn't think they were a candidate or they weren't particularly interested before you had enlightened them on why they should consider contact lens wear. Well, you're bringing a new service to that patient. You are prescribing a new product to that patient to purchase through the clinic, but also your contact lens wearers on average come back almost twice as frequently as your glasses only wearers bearing any kind of ocular disease state or reason for return. So there are a number of reasons that I personally am a huge advocate of wearing contact lenses, of fitting and prescribing contact lenses, of offering contact lenses to anybody who is a viable candidate, any patient in your clinic. So let's revisit the question. Why are contact lens fitting or evaluations needed every single year? The reality is, contact lenses are a class 2 medical device in the eyes of the US FDA. That's how they're categorized. And so we need to have annual evaluations for our patients to ensure safe and healthy lens wear. There's also the reality that some patients view contact lenses as a commodity. And so they may overlook the fact that these are class 2 medical devices and that there can be serious eye health and or vision complications when they're not worn appropriately. And we've all had patients come in, maybe they're prescribed a 2-week disposable or monthly disposable lens, and they wear it for 2, 3, 4 times the amount of time that lens is indicated to be worn. Or maybe they're sleeping in those lenses every single night, or maybe they're not cleaning their lenses appropriately. Well, that is not good for the patient. That's not good for us as eye care professionals. And we've had individuals come back to the clinic that needed to be prescribed prescription drops to get rid of corneal ulcers or complications that have ensued. And so it's important to let patients know about their eye health change over time, tear film quality, ocular surface, complications that can happen if somebody's not appropriately wearing contact lenses, as well as just optimizing the contact lens material, the brand, and the design that they're in, right? Prescription changes happen. There's a lot of innovation that's taking place in the contact lens space, and even a small tweak to your patient's prescription can make an absolutely huge difference in their quality of life. I mean, lens technology continues to push the envelope, and I'm excited to see not only where the big four manufacturers are at right now, but where they continue to take us 5, 10, even 15 years from now. And so, all of these factors and more are why patients need to be educated and enlightened on the professional services that you provide to fit and prescribe contact lenses for safe and healthy wear. And oh, by the way, if we're able to detect any kind of changes early, whether it's inflammation, whether it's neovascularization, whether it's poor contact lens habits, maybe a patient is about to drop out of contact lenses because they're not totally satisfied with their overall visual performance or how the lenses feel towards the middle and end of the day. Well, we can get ahead of these things, right? By having an intentional conversation, by evaluating the ocular surface, evaluating that contact lens on the patient's eye for healthy wear, and maybe even discussing alternative options, switching them from a monthly modality to a daily disposable modality, or maybe from a daily disposable modality that's entry level up to more of a premium and optimized design. So in my clinic, we try to be as proactive and transparent as possible when it comes to patients who wear contact lenses. We want to get ahead of this conversation by being transparent, being open, being honest. So when a patient calls the practice and they say they want to be fit and prescribe contact lenses, maybe they're a new wear, maybe they're an established wear, we pull patients' insurance benefits and we communicate these benefits prior to the patient visit. If their patient maybe reserved an appointment slot online, well, we also reach out to these patients and we communicate that to them as well. So we try to get that information out to them before they even show up to the clinic, right? Because we've all been to doctor's offices where you secured an appointment, you show up, and all of a sudden there's additional surprise fees that, well, it kind of dampens the experience. It makes you question, like, what's going on here? And so we have our fees upfront communicated out to patients before they show up. We also outline professional service fees in our patient digital intake form and have them sign off and acknowledge this information and understanding before they come in. If they don't, right, let's just say they don't fill out the paperwork, they don't answer our phone calls to further communicate this information, they're always communicated this information at the front desk and or when the patient is getting worked up to see the doctor by the optometric technician. And so I believe that getting ahead of the conversation is absolutely critical so that patients have the ability to make a decision about, hey, if I want to wear contact lenses, there are professional service fees that are associated with that. And not only is it going to be something that is best for my eye health and vision care needs, but it's best for my journey as a contact lens wearing individual. And my doctor has my best interest in mind. They're being transparent about the professional service fees that come along with this visit. So, how do we address kind of a combative question? If a patient's sitting in your chair, let's just say they've been wearing a -4 monthly or 2-week lens for 5 years and their prescription hasn't changed, which is a good thing, right? The reality is, if a prescription has remained stable, well, that's a beautiful thing because that means that the patient's eye health and vision care needs have kind of leveled off in regards to change over time during a certain period of time in their life, and they're being renewed and prescribed the same power and or the same contact lens brand or material that they're having success with. And so if a patient's frustrated, they're sitting in my chair, maybe they've even acknowledged it throughout the entire patient journey, whether it's through the front desk, whether it's at, during that pre-testing process, but then they sit down and they're like, I don't understand why I have to pay this fee every single year. It's important to be empathetic. You can say something like, I understand it can be frustrating to feel like nothing has changed, but this also opens up an opportunity for us as eye care professionals to educate patients on how contact lens wear impacts eye health and how annual checks are critical, right, to ensure safe and healthy and comfortable contact lens wear. You can reinforce the benefits of clear vision, comfort, preventing serious problems because a lot of contact lens patients have come in and maybe they've had great healthy wear for 10 years. All of a sudden they have an eye infection and they have to come back in and get a number of prescription treatments to take care of the situation, but also expensive office visits that coincide. And so giving us the opportunity to be empathetic, educate, provide the value of the service that we're providing, but also be confident about what you're doing. There's no reason to apologize about the professional service fees that come along with the visit and the care that you provide. I go to my primary care doctor every year. I know professional service fees are associated with that. I also know that there will be fees for lab testing. And I believe that it's in the best interest of my overall general health and wellness to continue that care annually based off of how my doctor is prompting me to do so. When I sit in the chair, he's not apologizing about his professional services that come along with his expertise of medical education and care for me as the patient. He's also not apologizing about the fees that come along with certain lab tests that need to be run for me to kind of dial in how am I doing from an overall health and wellness perspective. And so it's important to be empathetic, educate, and demonstrate value, but also be confident in the services that you are providing as an optometric professional. So a very simple way, somebody comes in, they're sitting in my chair, they ask me that question, Doc, why do I have to do this every single year? I acknowledge, hey, listen, I understand where you're coming from. I see how it could even feel like an inconvenience to come in and have to do this on an annual basis. But I also want you to know that you're fortunate that things have remained stable and that they're dialed in. In my opinion, no news is good news. And when prescription doesn't change, you've been at -2 for 5, 10 years. That is fantastic news. There's been no progression in your prescription, and your overall eye health and vision care needs have remained stable, which is not always the case in the world that we live in, especially with increasing utilization of technology, digital screens, and decreased blink rates when we're consuming content and we're going throughout our day to day. And so I enlighten them on, yes, this is fantastic news. Yes, you've been stable in a product that maybe it's been around for a while. And I also like to take it as an opportunity to present new technology to that patient. If they've been in a monthly lens and it's been out for 10 years, why not present to them the opportunity to try daily disposable contact lenses? There are entry level and there are more premium options available. And so it opens up that conversation. And it also brings back to the reality of the situation that fitting and prescribing contact lenses does take additional chair time. It is additional service and it is additional expertise that we have as optometrists. And we're fitting and prescribing class 2 medical devices in the eyes of the FDA. And it's our responsibility to make sure that patients are safely and compliantly wearing their contact lenses and that we're optimizing whatever brand, material, and prescription that they have accordingly. All right. So I'm curious, drop me some notes in the comments. How do you handle this situation? What are some best practices that you're utilizing? I'd love to hear it. And stay tuned for my next podcast where we can reflect and grow stronger together.